Assalamualaikum everyone, welcome back to this channel. So this is me Arya Vahid, and in this video we are going to study how the drugs are eliminated. So in the previous video we have discussed about the absorption, about the distribution, about the metabolism of your drug. Now this is the last topic of that chapter, and this is the elimination of drug. Now after all the metabolism, and now your drug is going to be eliminated or excreted out of your body. So actually the elimination of your drug is consists of two processes. First is excretion and second is metabolism. So first of all, the metabolism is happened on your drugs, and then it will be excreted out, and it is excreted out first of all by your kidney, and second it is excreted through other methods. So mostly the excretion is occurred through the kidney in the form of urine, but other methods are like hepatic liver is excreting, metabolizing it, and also excrete it into your blood, into your bile, and after it's released in your tears, in your sweat, and your feces also. So now let's discuss that how the drug is eliminated out through your kidney. So actually, when the drugs enter into your Bowman's capsule, enter into your proximal community tubule, enter into your distal community tubule, some kind of processes happen in each of these parts, and due to all of these three processes, the drug is eliminated outside to your body. So in the Bowman's capsule, first of all, the glomerulus filtration happens. In proximal convoluted tubule, the proximal tubular secretion occurs, and in distal convoluted tubule, distal tubular reabsorption happens, and due to these three processes, the drug is eliminated out. So let's discuss the first process which occur in Bowman's capsule, and this is the glomerular filtration. Now how this happens, so see in the diagram which is given here. So this is our Bowman's capsule, this is the afferent, and this is the efferent arteriole. So you know very well that here are a lot of slits or spores are present through which your drug is filtered out, or your all the kind of waste which is present in your body is filtered out and go into your nephron, and then after processing through the nephron, it is eliminated out through your body. Now what is going to happen, the process of your glomerular filtration is depending upon two factors. First is the change in the GFR. What is GFR? This is the glomerular filtration rate. So the normal glomerular filtration rate value is 120 ml per minute. Okay, so this is the normal value, but whenever the filtration, whenever the variation occurs, so this value disturbed, like a patient of kidney, a patient whose GFR never be 120 ml, whose GFR will be decreased, would be 100 ml per minute, so this could be occur. So now there are most of various kind of factors which are affecting your glomerular filtrate rate. And what kind of factors affecting it? Like the lipophilicity, mean how much your drug is lipophilic. It affects on your uh, filtration rate. And the second factor which affect it is the what is the blood flow. So how much blood is flowing through your renal. So this also affect your GFR. If the blood flow is low, then your GFR will be low. And if the drug is more lipophilic, then your GFR will be low. So therefore, when the GFR change, the glomerular filtration process is different. Last is the protein bounded. More the drug is protein or albumin bounded, more it will be difficult to release out because of the larger size. When it is in the free form, this drug is in the free form, now it can easily cross through the slits and move into the nephron, and then it will be secreted out through your body. So this was the first process of glomerular filtration. And the size of drug is also depending upon it. So you can say the size of drug. Now let's move on to the second process which happened in proximal convoluted tubule. So now after the glomerular filtrations which happens here, some of the drugs will move out in it. But most of the drugs which are protein bounded, they remains in this, and they will enter into the efferent arteriole, and from the efferent arteriole they goes into the peritubular capillaries. You know very well the efferent arterioles making your peritubular capillaries. Now these drugs I am highlighting them, so they are entered into your peritubular capillary. Now from the peritubular capillary they are excreted out. So they, this process is called as excretion. So they move from peritubular capillary into the nephron again back. Okay, so this process is called as secretion. Now it is depending again on the concentration gradient, that what kind of concentration is present here. Always the drug move from higher concentration to lower concentration. Size of drugs also matter. If the size is very high, then it is cannot be go. If the size is small, then it can goes. Lipophilic is very really matter. If the drug is lipophilic, then it can goes from here to here. Also the drugs can move here to here. So therefore these are the things that depend upon it. Now let's discuss what kind of processes happen. First is the passive diffusion. If the size of drug is small, if the drug is lipophilic, then it can easily cross from here to here. But if the size of drug is very high, and and we have to move the drug against the concentration gradient, then we will follow the process of active transport.